As a longevity doctor who specializes in the use of rapamycin, pretty exciting, this 2025 pilot study in the Journal of Translational Medicine, which was looking at low-dose rapamycin and how it helped with myalgic encephalomyelitis or chronic fatigue syndrome. And it's quite interesting that this particular syndrome has a massive amount of overlap with individuals who have long COVID, which is really a post-viral fatigue. Below there are 8 questions which we will be answering with short, clear answers for longevity-focused patients. And please note that the show notes of this are going to have a much more detailed technical response to each question, so please take a look through that if you're wanting to learn more about this. And certainly contact my clinic to explore rapamycin for your health goals.
What's the study about?
So this looked at low-dose rapamycin, which was 6 milligrams per week with no serum levels monitored or adjusted, like how we do in our clinic. But they looked at that and saw how it reduced chronic fatigue syndrome symptoms, including things like extreme tiredness, post-exertional malaise. And we think that this happened by boosting autophagy, which is the body's cell cleanup process. It shows a great deal of promise for chronic fatigue syndrome and likely for long COVID also, helping to restore energy to the cells.
What is rapamycin and why does it matter for chronic fatigue?
So rapamycin is an mTOR inhibitor. And this is something where overexpression of mTOR ends up messing up cell cleanup. And we think that in chronic fatigue syndrome, this ends up resulting in this symptoms that are seen. By fixing this, rapamycin can ease the symptoms and boost energy like it does in anti-aging patients. It's relevant for long COVID, similar fatigue issues also.
What did the study find, including how many patients benefited?
Yeah, so it was a fairly small cohort. So we ended up having 86 patients, 70 stuck with it for at least 30 days. Almost 75% of them felt less tired and had less other symptoms as far as post-exertional symptoms, moved better. Scores improved significantly with fatigue dropping around 20%, activity rose around 15%. Blood tests also showed better cell cleanup. Viral triggered patients did the best, suggesting hope for long COVID's overlap.
How was the study done?
Yeah, so this was a decentralized study. 6 different clinics gave 86 chronic fatigue syndrome patients the 6 milligrams of rapamycin per week over 90 days, slowly ramping up. They looked at symptoms and blood markers, and those were checked at 0, 36, 60, and 90 days using surveys along with blood work. There was no placebo, but this is still a solid start for real-world use.
Is rapamycin safe for chronic fatigue patients?
Yes, it certainly seems to be, just like with other patients in general. Mild side effects like stomach upset went away fairly quickly. There were no big changes in any of blood tests. Seems to be safe for long COVID also. But we certainly monitor it closely in my longevity practice.
How does rapamycin help cell cleanup in chronic fatigue?
Yes, we think that there's an overactivity of mTOR in this condition, and that blocks autophagy, which is really the process where your cells clean up diseased areas inside the cell. And all this buildup of things, which we would basically call adjunct inside the cell, ends up causing tiredness and causing these symptoms, is what we think. And rapamycin, by inhibiting mTOR, ends up boosting this cleanup. And we saw that on the tests that were done looking at autophagy in this study. This ends up cutting inflammation and boosting energy. And this could also help long COVID, similar cell issues, and slowing aging effects also.
Could NAC, ethyl ester, methylene blue, or low-dose naltrexone help chronic fatigue or long COVID with rapamycin?
I think so. It's not unusual to do combination therapy. A lot of times low-dose naltrexone in the range of kind of 4.5 milligrams per day seems to reduce inflammation and can have positive benefits in up to 60 to 70% of these patients. Methylene blue also boosts energy in the mitochondria, seeing somewhere around 40% in some studies that are small of benefit. NAC ethyl ester ends up improving glutathione and seems to ease fatigue slightly. And combined with rapamycin would seem to be a fairly logical approach to this, given that all of them are working through different pathways. Long COVID also is going to overlap with this, and is something where I think it is worth a try for people that otherwise don't actually have other good treatments.
What are the study's limits and what's next?
Well, I think the study has multiple issues. There was no placebo. There was a lot of self-reported symptoms. There were a fair number of people that dropped out over the 90 days. Good news is that there's a trial that is just starting now this year, 2025, with placebo, wearables, and also will be taking a look more objectively at chronic fatigue syndrome symptoms in these patients. Off-label use works now with my guidance, and my clinic can help with individuals who want to try this at this point. It is noted that this is off-label, but we do feel that it is safe.